Metformin is a widely prescribed drug for type 2 diabetes. It is often the first drug recommended when someone is struggling to control their blood sugar with lifestyle changes alone. It's part of a class of medications that work by helping your body to use insulin more effectively, which in turn helps to lower blood sugar levels. But here's the thing. While metformin is effective for helping to control and improve blood sugar, it doesn't come without side effects. And for some people, including vegans, vegetarians, and people who don't eat a lot of meat in general, these side effects can have significant impact due to the risk of nutrient deficiencies like vitamin B12. But before we dive into the details, I just want to note that diet and lifestyle changes should always be your first course of action, whether you have insulin resistance, prediabetes, or type 2 diabetes, or are struggling to lose weight. Metformin alone isn't enough to reverse these conditions. Yes, it might be able to help you manage them, but you really need to be making lifestyle changes if you're serious about reversal. With that said, metformin has been shown to be an effective tool to use alongside these changes, helping many people get their blood sugar and insulin levels in check. Now, let's get into what metformin is, then we will get into the side effects you need to be aware of, and most importantly, how to avoid them. And there's going to be timestamps on the description bar, so if you want to skip ahead, if you want to skip around, you can use those. Metformin works by lowering the amount of glucose produced by your liver and improving your body's response to insulin. This can help to prevent dangerous blood sugar spikes, which over time can reduce the risk of long-term complications and reduce your disease risk. Frequent blood sugar spikes can eventually lead to nerve damage, kidney disease, heart disease, and more. But it's important to note that metformin is not a cure for insulin resistance or diabetes. It helps to manage blood sugar levels, yes. It helps to improve insulin sensitivity, yes. But again, it is most effective when it is paired with a healthy, low-carb, high-protein diet. Metformin is also prescribed to help manage polycystic ovarian syndrome, or PCOS. Again, PCOS is rooted in insulin resistance, and this is why metformin is so effective at helping to reduce PCOS symptoms. It can help with issues like irregular cycles, acne, and other symptoms associated with PCOS. Now let's get into some of the most common side effects of metformin. The good news is that many of the common side effects, while they do occur at the start, for most people, they tend to go away after a couple of weeks or a couple of months. However, they can be a bit uncomfortable, a bit inconvenient, especially in the beginning. Some of the most common side effects that people experience are, number one, nausea. A large percentage of people experience this when they first start taking metformin, and they also experience vomiting as well. Digestive issues like bloating and diarrhea are also very, very common, unfortunately. Heartburn and indigestion, and a metallic taste in the mouth. Now, in terms of how to reduce your chance of experiencing these side effects, there are a few things you can do. The first one that's pretty effective is to just make sure you're always taking metformin with a meal. This can really help with nausea and diarrhea. Also, make sure you're not crushing the pills or splitting them at all. When you take them whole, then they take a little bit longer for your body to digest, and this slows down absorption, which is a good thing in this scenario. Switching to an extended release variation of metformin can also help to reduce symptoms. And again, a lot of times these symptoms do tend to reduce over time as your body adjusts to using metformin. But for some people, they can continue. Now let's get on to a few of the less common but more serious side effects that you need to be aware of, mainly nutrient deficiencies. One of the biggest concerns is a deficiency in vitamin B12, which is essential for nerve health, energy production, and formation of red blood cells. Metformin can interfere with your body's ability to absorb vitamin B12, and this, over time, can lead to low levels in your body. Vitamin B12 is an essential nutrient. We need it to survive. For people who are already at risk, like vegans, vegetarians, and people who don't eat a lot of meat, these people are already going to have lower B12 levels. So adding metformin to this scenario can put you at an even greater risk. Low levels of B12 can cause a lot of side effects: fatigue, dizziness, weakness, numbness or tingling in the hands and feet, and difficulty concentrating. If you are experiencing these symptoms and they don't seem to be related to anything else, it's really important to have your vitamin B12 levels tested. A simple fix here is to simply add more animal products into your diet if you're not eating a lot of them. Contrary to popular belief, they are very healthy, red meat included, egg yolks included. I have other videos on how to get more protein into your diet, which is also important. And by getting more protein, if you're getting it from the right foods, and you're also getting a good dose of vitamin B12. So I'll link one of those videos up above. Vitamin B12 deficiency can also cause serious side effects that can be permanent. So this isn't something to take lightly. Now, another serious side effect you need to be aware of is lactic acidosis. This is a medical emergency that occurs when lactic acid builds up in the bloodstream faster than it can be removed, and metformin increases your risk. Symptoms of lactic acidosis include extreme tiredness or weakness, difficulty breathing, nausea and vomiting, dizziness or lightheadedness, a fast or slow heartbeat, and stomach pain. While rare, it is extremely dangerous and can ultimately result in death. Certain factors can increase your risk of developing lactic acidosis while taking metformin, including kidney or liver disease. Since metformin is processed by the kidneys, people with kidney problems are at a higher risk. If you drink a lot of alcohol, this also increases your risk. And combining metformin with certain medications, like blood pressure medications, increases your risk as well. So again, if you are in any of these categories, this is something to talk about with your doctor and make sure you're monitoring and taking steps to avoid. Now let's talk about metformin and pregnancy. If you're pregnant or planning to become pregnant, you may wonder if it's safe to continue to take metformin. Research shows that metformin is generally safe to use during pregnancy and is often prescribed to women with gestational diabetes or PCOS. But again, talk to your doctor. Don't continue taking metformin without consulting with them first. Something to note is that metformin crosses the placenta, but it hasn't been linked to birth defects. Some studies show that it actually reduces the risk of complications during pregnancy because, again, it helps to lower insulin levels. But the long-term side effects haven't been studied. So again, this is why I always preach diet and lifestyle changes that are sustainable. You should be eating in a way that's fueling your body, that's high in protein, high in healthy fat before your pregnancy, and then you should be able to continue that same way of eating during your pregnancy. Of course, your number one priority is the health of your baby, so that goes above everything else. Now, earlier I mentioned a few ways to reduce your risk of experiencing side effects with metformin. I'm just going to recap those and add in a couple more. The first one is to start with a lower dose and increase as needed. This gives your body a chance to adjust to it. The next thing you want to do is make sure you're always taking metformin with food. So if you are someone who is practicing intermittent fasting, which can be very beneficial for insulin resistance and diabetes, you might want to try shifting your feeding window to earlier in the day. So instead of skipping breakfast, have your dinner a little bit earlier so that your fasting window starts earlier in the evening, and then you can eat in the morning when you take your metformin. Limiting your alcohol consumption, this will dramatically decrease your risk of lactic acidosis. As I said before, this is a rare side effect, but it is very serious, so not something to take lightly. And make sure you are getting plenty of vitamin B12 in through your diet. So foods like meat, fish, eggs, other seafood, dairy, all great sources. If you're getting enough in through your diet, then B12 deficiency shouldn't be a concern. But if you are limiting animal products or avoiding them altogether, then this is where your risk increases significantly. So in summary, metformin is a very effective drug for improving your insulin sensitivity, for helping you to reverse insulin resistance and prediabetes and type 2 diabetes. It's very effective for weight loss, but again, not on its own. It needs to be combined with the correct diet and lifestyle changes. I have other videos talking on ways to naturally improve your insulin sensitivity, and spoiler alert, these aren't hard changes. Anyone can do them. And the framework that I recommend and that I use with my clients, it's sustainable. It doesn't mean you have to cut out whole food groups entirely. It doesn't mean you can never have a meal out. It doesn't mean you can't ever eat cake or dessert or anything like that again if you want. You can do those things and you can reverse insulin resistance. But anyways, that's where I'm going to wrap things up for today. I hope you found this video helpful. I want to hear from you guys though. Let me know in the comment section if you have been prescribed metformin, if you're currently taking it. What's your experience been? Has it gotten you through a plateau that you were previously experiencing? Have you had any of these side effects? Let me know down below, and I will see you guys later. Bye guys.